Thank you, everyone. I'd like to welcome you all to Strategies to Increase the Inclusion of LGBTQI plus surgeons worldwide in orthopedics. This is a partnership between the International Orthopaedic Diversity Alliance and PrideOrtho, working together to promote LGBT surgeons. Next, I'd like to acknowledge country. This is a tradition in Australia and New Zealand to acknowledge our Indigenous nations. In the spirit of reconciliation, IODA acknowledges the traditional custodians of country throughout the world and their connections to land, sea and community. We pay our respects to the elders past and present. So thank you everyone for coming. My name is Jennifer Green. I'm the president of the International Orthopaedic Diversity Alliance and delighted to be hosting this event with PrideOrtho. I'm going to hand over to my co-chair today, Julie Samora, to introduce our first guest. Thank you, Julie.
Hi, thanks, Dr. Green. This is a real privilege to be here. My name is Julie Samora. I'm a pediatric hand surgeon in Columbus, Ohio, and I'm a past president of Ruth Jackson and also a board member of PrideOrtho. So we have a great panel of speakers, and I'd like to allow Dr. Schultzel to introduce himself, who's another board member of PrideOrtho.
Hi, everybody. I'm Mark Schultzel. I'm an orthopedic surgeon specializing in shoulder and elbow surgery based in San Diego, California. And I'm the treasurer for PrideOrtho. My focus is on international medicine as well. So I work additionally in Tokyo and Tochigi, Japan.
Dr. Hammouri, would you like to also introduce yourself, another PrideOrtho board member?
Hi, my name is Qusai Hammouri. Everyone calls me Q Hammouri. I'm originally from Jordan. I'm practicing in New York City. I'm a pediatric spine surgeon, and I'm also on the board of Pride Orthopedics. I'm the president of Pride Orthopedics, and I'm very excited for this wonderful group of panelists and to have this discussion. I think it's long overdue. And I would pass it on for Claudia to introduce herself.
Thank you, Q. Thank you, Julie and Jennifer and IODA for inviting me. I'm not in any committee role or a presidential role here in IODA, but I'm certainly very proud of being in the LGBT and LGBTQ plus member. I'm an orthopedic surgeon in Australia, in Melbourne. Mainly my focus is with regards to surgery in joint replacements and sarcoma. And I'm really honored to be here. And I really hope that my experience as a Italian surgeon and then moving to Australia, and also, my experience with family and the rest that goes around in life can be of help today in this conversation.
Thank you. So our fourth presenter today is having to do an urgent case, and we hope that Tatiana will be able to join us later. So at our next speaker, Q will commence talking about his experience. And thank you, Q, for starting off the discussion.
My pleasure. And just for timekeeping sake, I have
approximately 10 minutes.
Okay, great.
So, yes, sorry, our format will be each speaker will have 10 minutes to speak, and then we'll have discussion at the end. And we'll very much invite questions from the audience.
That's awesome. Fantastic. I think my experience is each of us has a very different, unique experience. And you could argue that most people have a unique experience in orthopedics, but some of us have to climb over higher walls, cross longer bridges, make longer leaps just to get to the same starting point as others. And so and it depends on where we practice orthopedics. I would say I grew up in Jordan, and going to medical school in itself was a big hindrance. And I was not out when I was growing up, nor was I when I was in medical school. I would imagine if I was, it would have been next to impossible to actually get into medical school. So I never, that was a hurdle I didn't have to take at that time. But being international and being a foreign medical graduate, getting into the US medical system, becoming a doctor here, becoming a surgeon here, is in of itself a hurdle. So the next hurdle I faced was not related to my sexuality, but rather that I am from a developing country, or from a country that is not Western, not European, or not American for that matter. And that was the biggest challenge: getting a visa, getting acclimated, being okay with the culture, being understood, and being accepted for who I am. Part of it, orthopedics is a very, I would say, within the US, has one of the lowest number of foreign medical graduates, also has a low number of diverse individuals, if you count that as far as gender diversity, ethnic background diversity, racial diversity, or whether you're an immigrant or not, compared to the patients we treat. So our patients tend to be a lot more diverse in each one of these categories compared to us. And getting into orthopedics in the US, it's hard because it's expected that you speak the lingua franca of essentially jockey orthopedics, for lack of better words. But there is a very particular culture that you're expected to learn, and some medical students learn that in the US in medical school as they're going through the system of what is expected for you to do as an orthopedic resident and what is not proper for you to do compared to any of the other subspecialties. And then as you become a resident and you kind of try to participate, there is, my experience, I would say there is definitely a number of ways in which the residents bond or the group creates a group identity that is not open for everyone. At some point during my fellowship programs, interviews, and my residency program interviews, on one of the interview nights, some of the chief residents took most of the men to a strip bar, which is exclusionary to women, exclusionary to, it's problematic on a number of different levels, but that's one of the examples that happened in my time. And I'm aging myself a little, this is in the past 20 years, but that is something definitely that sets the tone for what we expect or what is acceptable, or what is a acceptable group bonding activity. Other ways, other challenges that I remember facing in residency at that point is just being acknowledged, like your naming. I remember we had some foreign medical students, and one of our attendings during surgery couldn't pronounce their names. And so he took his marker and basically wrote on one of them, John, and on the other one, Mark, rather than their native names. And you could essentially say that he deleted their native identities and replaced it with a constructed local one. I found that some of that hard, just culturally. And then there is a certain kind of difficulty for being accepted as, slurs, microaggressions, and sometimes macroaggressions. Like when I first came to the US, it was shortly after 9/11. I heard from some of my attendings comments like, "Are you here to blow us up? Are we going to be safe with you around?" So at that point, it was more about being accepted as a foreign doctor, someone who's Muslim, someone who's Arab, someone who's maybe I had a bit more of an accent, maybe what I looked like was a little mapped more Middle Eastern. I didn't so much kind of have my gay side as out. And then as I went through residency and work, I would say it's definitely hard to be out in orthopedics. And up until PrideOrtho, we didn't really have any presence of LGBTQ or public presence of LGBTQ people within orthopedics. I remember reading Julie's article in AOS Now that had interviewed a number of gay orthopedists. What's most telling about it is most of them were anonymous. Most of them did not feel safe enough in the 21st century to put their name down as outwardly gay or part of the LGBTQ community. And I have to call out two people who were brave enough to be on that article. Joe Lessler, who's part of our board, who is like extremely brave and amazing man. And Aisha Rahman, who also is named in person and talked about her experience. And afterwards, it was my first time knowing that there are other people like me. I thought for the longest time, it's only me, maybe, and two other random people around the country who are part of the LGBTQ community within orthopedics. And this finally kind of gave me a sense. And kind of this concludes my story. We kind of get to Pride Orthopedics, and all of a sudden I go from knowing 3 or 4 people. We host a happy hour, then we start organizing, and we have now about 150 members, and we are reaching LGBTQ students, residents, and attendings, and some people who are in between. And I think one of the biggest ways that this drives home is having a safe space for identity. Having Pride Orthopedics as such a space, IODA as such a space, but having a safe space for all of us to show up and say, hey, I'm me, and be respected for that is really important. Every time I went to an orthopedic conference, I felt that the conference was not for me. I was not welcome. Everything was geared for someone else, and maybe that's my insecurity. But as I talked to a lot of people, they felt very similar in a way. And last AOS, it was the first time where I felt truly welcome, where AOS celebrated Pride Orthopedics, and being gay there was not a matter of derision, it was a matter of pride, the way it should be. And so I think if you review like some of what I talked about, it's like, I think safe spaces, very important. Strong, brave individuals who come out and say who they are and talk about their experience, like Joe and Aisha, and then strong and committed people to promote such diversity, like Julie, when she writes it, when it was the first time someone wrote about this within our literature. And finally, spaces where we can have webinars like this. For people who are not part of the community, I would say, remember that each and every one of us is, especially when in a place like orthopedics, are struggling and having a hard time. So anything you can do to support, as in like asking if you can help, asking if there's something you need to support, and then just making sure that the environment we're working in is safe, calling out microaggressions, calling out inequities. And it's easier if you're not from the group that's being kind of pushed aside, to highlight that that is an injustice. I think I'm almost out of time here, but there is so much to do, but it is remarkable how much we've managed to do collectively in the past 2 years, and just makes me think about, in 5 years' time, will orthopedics look like psychiatry in matters of diversity and acceptance? Unlikely, but I pass this on back to Julie and Jennifer.
I'm not sure if we lost Jennifer. Jennifer, you're talking. We cannot hear you right now. So sorry.
Apologies. Thank you. So our next, thank you so much, Q. Great insights, and we'll look forward to exploring that further during our discussion at the end of these talks. Next, I'd like to introduce Dr. Claudia Bella, who is going to speak about her experiences as an academic surgeon and a parent in Australia as an LGBTQI woman. Thanks, Claudia. I'll hand over to you.
Thank you, Jenny, and great talk, you. And it's fantastic to see how, well, fantastic, sometimes maybe not necessarily, to see how much the experience can really be similar, although in, you know, completely different maybe parts of the world, or you know, in my case as a woman, as a gay woman in, you know, in training and moving countries. I've you know, where I grew up, where I was born is in Sicily, which is down in the very south of Italy. And I remember a lot of people telling me, "Oh, what do you mean you want to do medicine? You don't have anybody in your family that is a doctor. You're a woman." So, you know, I don't know if you really have the push or the attitude for that. And it's funny because I heard, and this is one of my professional idols, Kirsty Weber, once saying that, you know, the more she got told no, the more you know, pushed to do something she was. And so for me, no, it really was not an answer that I was expected to take. So, but that was, of course, I didn't know that. I just loved what I wanted to do, and I just knew that, you know, deep in, that was the right thing to do. So I did medicine, and I started to do orthopedics, and I moved from the south to the north part of Italy. I went to the Rizzoli Institute, which some of you might know is an orthopedic hospital. Only orthopedic is the dream, really, of an orthopedic surgeon, and I absolutely loved it there. And it was a time of my life where really all I wanted to do was pretty much do what I loved. I didn't think about my sexuality. I didn't think about my gender. I didn't think about all the barriers around me. Almost really, you know, behaving like a little bit of a, you know, neurodiverse, perhaps. You know, I couldn't see everything around me. I couldn't see that I was the only woman in my group. I couldn't see that, you know, that there was some barriers that that were very obviously there. So for me, it was just doing that, and probably that helped me. But I recognize, especially now that I see all these things and I am on the other side of the fence, I can see how that really stops many people in their way. So it's not something that, you know, you need to be built in this way to be able to do it, because otherwise we are really going to exclude a lot of people that are incredibly talented simply because of the fear, simply because of the you know, they're feeling not accepted, and because we create those barriers. So for me now, this is a great passion of that I have, that is really to try and remove these barriers. At the time, I started to explore my sexuality, and I knew that I just could not be who I was in the workplace. So it was fine at work, but, you know, that meant that while I was in training, my colleagues could not be my friends, because there was a big part of me that they could not know, and I didn't know why, but for me it was like, well, that is something that would not be accepted. I knew somehow, although, you know, I didn't explore this, so I didn't know if I was going to be accepted or not. I just couldn't you know, try that just for trying and then be rejected. So I remember those 5 years as some of the most beautiful years of my training, but at the same time, the toughest years from my personal life. My supervisor, my boss, who I absolutely adore, and he still is my professional father, and I have a great relationship with him. I did have a great relationship with him at the moment, but he was a very religious man, not in the sense of, the bigot religious, but very, very religious, like you can be in Italy. And I could not let him know that part of me. So there was constant lies that are white lies, but at the same time, they make you feel like you are there as half of a human. And this is probably one of the reasons why I kind of like took the courage and moved to the other side of the world. I needed to be so far from all of that. And it was a blessing for me, because I moved here to Australia at the end of my training there, and I had to do so much more, of course, do more training and everything. But for me, it was like, well, I can move there, so I'm just going to be myself from the beginning. And because I've already proven myself somehow, then it was a little bit of a more freedom. So there is that difficulty of, when you're in training, when you have to constantly prove yourself professionally, that, the ability of prove that, or be yourself when you are different, is difficult, is an extra level of difficulty. And just like you were saying, that fear of not being accepted, and also that feeling of not being, of that environment not being catered for you, it's something that can be a significant obstacle for a lot of people. So now here in Australia, I certainly continue with that pathway of just going for my way, and not taking no for an answer. And I have a beautiful family, and I'm the head of the sarcoma unit here in Victoria, which is the only sarcoma unit I think in the world that is made 100% of women at the moment. We're only two, but we're only the two women that do sarcomas in Australia. But still, it's something that I know that I can give, and my diversity is a strength. So this is one of the things that I started to realize later in life, that actually my diversity was not an obstacle, and I used it as a strength, especially now with what you were saying, is that now it is absolutely right. Times are changing, and we are changing these times with support and promotion of women in all fields of STEM fields, but especially in surgery, especially in orthopedic surgery, where we're really a minority, and really supporting that, what diversity can give to this profession, and we really are in a great position here to prove this. So as a woman, as a gay woman, for me is a privilege to be in this position at this moment in time, because I know that although there is a lot to do, there's certainly a great intake. People are our allies, the vast majority of them. Of course, you still get shocked when you hear some people really having comments that are quite strongly against this. And I guess breaking traditions take more than one generation. But there is no doubt that we are at the right place at the right time now to really have our diversity as a strength for us, and to really help other people joining this fantastic community, because the reality is that we are here to serve our community. And so for me, being a woman, for me being a lesbian in this community, I can see how much I can help people that otherwise would feel so detached from their treating surgeon, that then in the end their journey is compromised simply because of that detachment. And the detachment is actually bilateral. It's really difficult, I understand, for a 6 foot tall white man to relay with the pain of a 70-year-old woman that does not need to go and play golf, but wants simply to just be able to cook dinner for their family, for example. And so for them, perhaps that is something that the surgeon might feel like, that's not that important. So there are these kind of barriers. There are bilateral, and I think that we're here to be able to break them. And so if there is just one thing that people can take from my chat, is to simply consider our diversity as a strength, because we really have a huge amount to give, and this community needs us. We as LGBTQI plus, or as women, as Muslims, as or different, everybody, everybody's different, and our diversity is a strength. And so, with this really, I conclude, but I'm very happy to talk more later and answer the questions. But this is really my my take-home message, which is always in the optimistic kind of way. And I give back to Jenny and Julie. Thank you.
Thank you so much, Claudia. That was amazing. And we look forward to further discussion. But in the meantime, we'll introduce Mark to take the stand now and talk about his experiences working across the world in different nations and different cultures, and particularly Mark's experience in the Asia Pacific region, which we know has been an area that has been a little slow to accommodate the LGBTQI plus community. And hopefully we'll have some insights that will be applicable to the Australasian Asia Pacific region. So thank you, Mark.
Absolutely. Thanks so much for having me. So yeah, my orthopedic path really started from a young age. I had the good fortune of growing up abroad. So my family lives in the San Francisco Bay Area, but due to my dad's occupation, we lived all over the world from a young age. And until I had a twin brother, so I had a built-in best friend and easy travel partner. And a lot of the time was spent in the Middle East and the Far East. It was just such a great opportunity. For me, it was important for my formative years to learn foreign language and make friends in new lands, which I think has paid dividends as a surgeon, because my job is to try to connect with people and earn their trust, and because they're putting your lives in your hands. And so it was one of the best gifts our parents could have given us. And also really made me realize how nice we have it here. We enjoy a lot of freedoms here that many countries and citizens don't in other lands. But also with the goal of finding commonalities between us and finding ways to do better. And so in my path to orthopedics, I did a residency in Kansas City, and then a fellowship at the Curlin Job Orthopedic Clinic. My link to Japan has remained very strong. I love the culture of the country. It's just very richly steeped in history. As a foreigner, they have this idea of something called omotenashi, which is it's a hospitality-based statement, which really means to show the guest just such level of hospitality and friendship and kinship. And so, as a foreigner who's been there, who's lived there, and has also come back as a tourist or come back for work, that amount of hospitality never wanes. And I really like that about the culture, because for patients, it's very welcoming for them. And so it really resonated with me. I created an exchange program between my medical school at UC San Diego and a few hospitals in Japan. That allowed me to keep in touch with them as a system. And since then, those relationships have really blossomed, where I've gone back to teach, helping to bring reverse shoulder arthroplasty to their market, and then also to work in concert with teammates who are in anesthesia to improve the quality of care for regional anesthesia, for instance, in regards to interscaling blocks and other type of treatments. The biggest thing culturally, so is practicing there, it's very different than practicing in the United States. Starting from a patient perspective, patients in Japan especially will speak in very formal Japanese to the physicians. This can be a problem in more rural areas where the level of education is slightly decreased, so the ability to speak very formal Japanese is difficult. Even for me, I speak fluently and understand medical Japanese well. My understanding of formal Japanese, the very formal, which is really meant for upper levels of management and government, is actually quite limited. And so we can actually create a language barrier even within the Japanese people, who are all a homogenous society. So I would oftentimes resort to telling patients, please speak informally to me, which would be meant almost as, people would think it would be rude to do that, but you have to try to find some way to find a commonality and to understand your patient. The patients also don't look you in the eye, and this is a respect thing. And so this can also create problems. I often joke that my colleagues in ophthalmology have to chase their patients' eyes around, because it's hard to get them to perform an ocular exam because they won't look you in the eye or look where you need to look. And so it's just one of those cultural nuances that make the practice of medicine in Japan especially unique. Throughout Asia too. I think it's been interesting being a foreigner there because I'm very obviously not Japanese. And so being from another country, being a third culture kid, you know, I do get a little bit of leeway because I don't look like everybody else. And then it's met with surprise and more intrigue that I speak their language. That does give me a little bit of a pass, especially if I make a faux pas or doing something more the American way is given a little bit more of a pass. And I think that's also because I'm a white American coming from there, whereas maybe somebody coming from a different culture or women may not have always the same level of latitude given towards them. I think the international practice is really fun, though. I think that the biggest thing that I love about it is it's so unique. You have to learn to think a different way and also to learn how to integrate within another culture to provide care. And the onus is really on me to gain the trust of my patients or to work with my team as much as I can. I think that's a little bit different than the way we do it here. You know, in the United States and you know, in Australia and in a lot of the Western countries, it's really individualist centric where you stand out as an individual. But, you know, especially in the Far East, there's much more of a communal nature to what the value that you have is. So you work well in a team, but if you stand out, it's actually considered to be a little bit of a negative, taking away from the cohesiveness of a team environment. And this is pretty common throughout the Far East and China, Korea as well. Very similar styles of the way they approach medical care. In terms of being in the LGBTQ community, I think it does present a little bit of a challenge. Again, I think because I'm you know, an American, I think I get a little bit more latitude. In Japan, particularly, LGBTQ issues are met a little bit more and dealt with feeling as if they're a fetish or not, or more like an interest, but not like the core being of who you are. And so people are not rude or limit you from opportunities, but it is meant more with like intrigue and curiosity, but something that's not taken very seriously. In other countries that are a little bit more austere in terms of the way they approach those rights, like in Korea and in mainland China, it can be a lot more difficult to gain acceptance that way. Where it can become an issue in some of these countries as well as, again, with the communal nature of how people work, a lot of times there's camaraderie that happens after surgery or after clinic work. In Japan in particular, and actually in some of the hospitals where I work at, I work in a lot of towns where there are hot springs. And so what this ends up being is, you know, communal time in the hot spring. And so I would say I've never been treated poorly or, you know, had any questions or things like that, or people unwilling to, you know, spend that time. But that does sometimes happen in some communities where just the fact of you being a little bit different is enough to scare people away. Or to make people nervous about, you know, who you are and what your intentions are. I think my biggest take-home message is to not be afraid to practice internationally. I think that you have to change your mindset a little bit and be willing to integrate with the culture, learn their language, learn their customs, and also understand where you fit into the entire milieu of how you practice. I think it's incredibly rewarding, especially going to places where the medical care may be underserved. So I've done some missions in the Philippines and in Indonesia. And, you know, Indonesia particularly is a Muslim country. And so, and some of the islands practice Sharia law. So again, that even makes a whole nother layer of challenges, you know, especially if you're known to be an LGBTQ physician. I think Q could probably elucidate a little bit more about that much better than I can. But again, I think it's kind of understanding where you fit into the system and then making sure that you can keep your identity strong, but you know, understanding how to work within the culture. I think Claudia also had mentioned before about like little white lies and identity. I tend to think of things as when I'm traveling or if I'm trying to determine whether or not it's a safe space to disclose sexuality or identity. I think of it almost like being like a secret agent where you're infiltrating a system and people are then learning your worth. And then that's when you can divulge your personal information or really live authentically. But I would say overall, I think it's been a great experience. Big challenges for working abroad, especially in the Asia Pacific region, is you have to be completely fluent. And you also have to take the medical examinations in those languages. They're not easy, but I think it's very much worth it. And I think also the cultural exchange you get and the exchange about how we practice medicine a little bit differently is a great way to enhance the medical care that I provide even here in the United States. So I'll toss it back to you, Jennifer.
Thank you so much, Mark. Very interesting, and certainly like to explore that a bit further. Unfortunately, Dr. Tatiana Quinones has had to do an emergency surgery, and she may or may not make it to our session today. So we are going to commence the discussion now, and I will hand over to Julie Samora to start the discussion with our wonderful speakers. Thank you, Julie. You just need to unmute yourself, Julie.
Touche. Thank you so much. Okay, so this was a really wonderful sharing of experiences, and I appreciate all of the speakers being vulnerable. We do have a few questions in the Q&A session that I'd like to start with, and anyone is free to answer these. Dr. Hammouri, just so you know, your video is not on if you want to share your video. So one of the questions that was asked is that basically they started with a statement that people will finally get the idea that sexual preferences, gender, religion, race make no difference to being an actual orthopedic surgeon, and can actually at times be seen as being a benefit when people are diverse. The question is, how do you respond when people ask about your capabilities based on your sexual preferences or your gender? What is it that you say, and has that changed over time? And I'd like to open that up to the panel.
I guess I can start. You know, it's kind of funny. The only time it's actually really happened to me in seriousness was when I actually practicing in Southern California. My first gig in SoCal was a managed care institution here that's pretty big. And I was outed, and then there were questions from the other surgeons in the group about my capabilities based solely on that, which I thought was very interesting. In Japan, I haven't ever had a problem with it. It's more the questions come about socially, or I think it's just more out of intrigue. So I would be asked more questions about, like, how does it work with your partner? Like, what are the nuances of a relationship more? And again, it's not out of any type of discriminatory ideals. It's more out of sheer curiosity. And I kind of liken it to some of my friends have taught English in the country coming from other nations. And if you come from another ethnicity that isn't white or Asian, there's a lot of curiosity because there's someone that these people have never seen before. So I've had one of my classmates is African-American. He went over there and he said that people would touch his hair frequently, not to be rude, but just out of sheer curiosity for someone that's different than them, and just had a lot of questions. And he became the most popular teacher in the group. But a lot of people would perceive that as being just overtly rude, because it's definitely different than the way that we Westerners would interact with another person. Yeah, I would think it would be incredibly rude if somebody were to just touch me without asking.
Thanks, Mark. I might add something. In my case, is more my gender rather than sexuality. Is not something that maybe because I'm in Australia, it's quite open here from that perspective. But often, for example, I get asked by patients, "Oh, is it going to be you doing the operation?" Or they try and they look at my junior, the fellow that often happens to be a man, and they kind of like so when they ask, I've in my case, I always, once again, like to break it down with a bit of a laugh. So I just say, well, it's in your case, it's a complex surgery. I would not let my junior do that. So you're lucky that it's going to be me doing your surgery, kind of thing. So I just try and often, rather than taking it personal, because often it is a limit of the person that is asking rather than your problem. So helping them on kind of like in a relaxed way to realize that that makes absolutely no doesn't affect your ability of being a surgeon. On the other hand, though, from regards of the sexuality, it is true that when I was a junior, when I was in training, I didn't feel comfortable on telling my own, being open about my sexuality. And that's because there I had to prove all the time, and it felt like I needed to pick my battles, right? So I just wanted to prove first that professionally I was capable, and as a woman perhaps just slightly more capable than the average standard orthopod, but that's a different kind of conversation. And then, once that was out of the question, then, with colleagues and everything, I felt comfortable of being myself. But yeah, I find that sometimes with people that perhaps ask not because they want to hurt you, but simply because they kind of like, they don't have that knowledge, helping them without having that kind of like hard feelings, but in a nice and relaxed way and with a laugh or with a joke, kind of helps.
Q, could I ask you, as the head of PrideOrtho, we have a lot of allies who would like to help enhance the inclusion of gay and lesbian members of our community. How do we do that as allies? What hints can you give to our organisations, our leaders and our colleagues about how we can do better?
I would say you start off by being open to people, and by announcing your support or telling people, hey, I'm here if you need anything. Just showing that you're positive as an ally. Could be as simple as wearing something supportive, saying something supportive on Pride Day, Happy Pride. All these little kind of things you can say to people can indicate to them that, hey, I'm on your side, I'm supporting you. The other one is to be someone who intervenes as a bystander. If you helping to create a safe space for everyone. So this applies not just for gay people, but for any minority or any underrepresented group, where if you see something that is not the way you would want to be treated, the simplest way, then say something. There's a little more training. You can actually go and get training called bystander training. I think Julie has done a decent amount of lecturing about this. But you can be as a bystander for shorthand if there's something, you see a behavior, and if you were on the receiving end of it, you would have been upset. You can say something, or you can say something to the person who's being injured. And by being supportive publicly, by saying, hey, Happy Pride Day, everyone. You're straight, but you're telling everyone that it's Happy Pride Day. That sends a message to people that, hey, you also celebrate it. You see the people during that day. But by the same token, you can apply this to Black History Month, Asian American Month. There's so many ways where you can just say hey, I see you and I want to support you and be there for you. Those are a few of the mostly social things that we can do in interaction and in statements, using proper language, taking the time to ask people about their pronouns. That is a great opener for people who are within the LGBT community, acknowledging those pronouns. And the final thing I would say, a lot of people I talk to say to me, we want to be helpful, we want to be supportive, but we're scared of messing things up. And I would say, if you go out of this with one thing, I would say, remember this: it's okay to mess up. As long as you kind of are sincere about it, then you go back and try again. We all have messed up something. So if you get something wrong, not the end of the world. You can be, someone will we can correct you, and just engage with us. That'll get you closer.
Thank
So
you.
that's sorry, I just wanted to follow up on that, because there were a couple questions in the Q&A queue about specifically if you're sort of at the lower rung of the hierarchy, you're a med student or you're a resident or you're a fellow or maybe even a junior attending, and someone more senior, could be the chair, could be a senior attending, could be a senior resident, says something inappropriate. How do you carefully sort of diffuse that situation when you are sort of the low man or woman on the totem pole, if you will?
I would start by saying, it's really hard. Having been there a number of times myself, being the junior person or the lowest person and being dissed or offended or anything, it's really hard because you have no support there. Most of the time, I personally let it go, smile. If you can take a stand, but it will hurt you, especially given some settings and some situations. It can affect your evaluation, how the rest of your rotation is going to go, your relationship with that attending. More useful, so that might be hard. I would say in a setting like that, you can find allies, look for them, someone senior to you to help you kind of like, maybe they can talk to that person and inform them. I see with the newer generation, more and more younger people are more upfront and very conscious about things, and they will speak up, but it comes as a consequence. And so that's not the right answer for everyone. And so I would say your safety should be first. Speak up if you feel like it, and then gather allyship around you. And worst case scenarios, you are protected by the laws in a number of countries. And so if anything amounts to the level of inappropriateness, you can go that route. But a lot of times it might produce more harm than good for you. If you, I would say soft power, soft discussion, and ultimately maybe that person doesn't even know. So if you feel a closeness, you can maybe approach that person in private saying, hey, when you refer to me with that word, I'm not comfortable with you calling me that way or something like that. And, you know, remember, most people are not out there to be evil. People make mistakes, and those mistakes sometimes can be corrected. There are some malicious characters out there, but a lot of people respond with a nice, kind, sincere word where we don't embarrass them.
Mark, you had something to add here.
Yeah, I really agree with Q. I think with everything with even there's been some questions in the Q&A about when is the right time to disclose. I think really taking the temperature of the room and having good situational awareness is really important. And so, I think my thoughts on it are, I always tell this to my residents and fellows and med students is if you have a mean attending when you're in training, a lot of times it's because they have some sort of personal inadequacy that they're trying to deflect. And so don't give them a pass, but just understand it may not be about you. It may be about them worried about that they're not doing well at a case, and then they have all these eyes on them, or some other, maybe they're having problems at home, or some other weird reason that really shouldn't give them a pass or a reason to come at you or to call a name. I do agree with Q. It's always best to let things roll off your back if they seem innocuous. But if you do really feel that this person is really hurting you, I always think the best idea is to take them aside and say, hey, look, I really respect you. I'm here because I want to learn from you. What you said was very hurtful to me. Moving forward, please could you not refer to me using those names or things like that? That would make me feel much more welcomed in your OR. And I think coming in from the situation where like, I'm coming here to learn from you and I respect you, please show me similar respect. I think it goes a long way than having a more adversarial approach. And I think it puts the ball back in their court to come along and be the more mature person.
Claudia, would you like to add to that commentary about dealing with these microaggressions?
I completely agree with Q and Mark 100%. As my son would tell me is, well, this sounds like a you problem. Something that is actually the person that is doing that maybe is their ignorance, which can be absolutely unconscious. So that approach, I feel that what Q was saying and Mark, I think is very, very helpful. So rather than taking it, straight on, because it can hurt you. It certainly can, we still are in a close community. So it's still something that, certainly when you are in the, in the low rank of that career path, you certainly don't want to have people talking on your back because you are maybe a troublemaker or something. And then everything gets kind of like stained that and has got nothing to do with your actual ability or just with yourself. It's simply that there is fear or ignorance behind that has driven that and then gets out of control. So it's very true that I think you've got to be a little bit careful, unfortunately, still, but finding allies, and they are everywhere, especially now. The juniors are incredibly open to that. So maybe you might not find necessarily in that rotation the ally out of your seniors, but certainly try and diffuse that by having a bit of a joke with the allies that are your peers, and then knowing that you will be moving on. And I know that might not be the best thing all the time, and I know that it can be hurtful, but some things are temporary. And then later on, when there is not anymore that kind of level of difference in your position, then it's something that can be perhaps addressed if it is at that level of significance, I think.
Yes, and I think not everyone is going to have an ally in their immediate environment. So, I'd just like to talk briefly about the benefit of being part of a network and finding your people there when these things go down. Q, do you want to talk about the advantages of finding a network and a safe space? You've mentioned them briefly, but I think in this situation, it's really important because there are people who are quite isolated in their work environments.
So thank you so much. I would say it helps to start off with is to have thick skin, right? If you're someone who is different going into a new field or trying to brave a new route, it really helps to have thick skin and let things roll off your back. But then, because you're going to face adversity, that is part of your way. I remember I got an email from one of the residents I did residency with who said to me something along the lines of, I remember you in residency, and I remember how some people were really mean to you. I'm so sorry about that. And I'm happy that your career went well. And I don't remember that adversity up until I read that comment and I thought about it and I was like, oh, right, that was hard, right? But I let it go because I needed to move on. But when you do meet other fellow people like you, when you do feel other people who recognize the adversities that they faced, it is tremendously helpful. You feel like you belong to a team. You recognizing someone who's exhibited or has gone through something similar to what you've done is tremendously helpful. And the last thing I would say here is sometimes meeting and kind of allying with someone else who maybe is not gay, but has faced the challenge in orthopedics in itself is helpful because both of your difficulties are similar in some level. I think it's tremendously helpful from a mental health perspective and from seeing yourself as part of a community perspective to kind of engage in a community like yours, or kind of depending on which level of like you want to be, whether it's LGBTQ, minorities in medicine, minorities in surgery, any of those.
Thank you. So I just wanted to briefly touch on the issues of being part of a minority and challenges with, religious and cultural issues, such as, Q being a Muslim, Claudia coming from Catholic background, a very Catholic country, and Mark having worked in Asia Pacific in a region where really it's not particularly acceptable to be gay or lesbian. How do you deal with those challenges in that particular aspect of life? And how do we bring those people into the discussion? Mark, would you like to start and talk? Did you actually come across anyone else who identified when you're in the Asia Pacific region?
Yeah, I think it does happen. I think everyone's trying to find some sort of commonality. I remember when I was a kid and would do some traveling and living in other countries and being at international schools, and I was surprised. So everyone in the international schools are very kind to each other. So you're friends literally with everybody. And then it only took when I got back to the United States for high school, and I was like, wow, American kids are mean. Like they're all really mean to each other in high school. And then I realized, well, you're a much smaller cohort when you're in an international school. So it's you and everybody else in the town who's not like you. And so you do find this commonality and this kinship. And it's kind of the same thing here. So you would find kinship with people of your kind of similar ilk. And so I remember, I was doing a case in a hospital in Tokyo, and I had a resident who came up to me from anesthesia and said, "Oh, I heard about you," and then actually another general surgery resident came to talk to me too, and they just wanted to talk about kind of what it's like practicing. And then we've made friends since, and you find your people where then you can bounce off each other ideas and topics. You can vent, you can share great times and bad times, and have a big support system for yourselves. And so, I think it's important to find those people, but there's also a ton of allies everywhere. Regardless of culture, you're going to find someone. There are so many people that have a family member who's in the LGBTQ community, a friend, another colleague, someone they've worked with, a neighbor who they're friends with. And so I think it's becoming more and more understood that we exist, and we have worth and value. And so I think you just got to put yourself out there and find those people, and also come with an open heart and open mind. I think, like you said, you understand that people are going to make mistakes, and to understand if people come with an open heart, that they can be of great value and support to you.
Claudia, would you like to have a brief final comment?
Yeah, very briefly, because religions and cultures are so embedded within the community where we are in, and it can be really, really difficult to, you're certainly not going to try, and break them so easily. So for me, my experience with my Italian boss and professional father is that, for me, it was like, I just waited for the right time. And then the reality is that he actually then thanked me, because he managed to actually change a little bit his idea. And that's proof of his, he's a fantastic man, but it's just the ability of him to say, well, look, I know you, I know what a great person you are. So it probably is my bias coming from my religion on thinking that there is something wrong with being gay. So that was a great pride moment for me, but it took a good part of 10 years. So I'm not saying that it is an easy thing, and we can't just change the whole culture, but with the people that know us and know who we really are, even if they might not know that part, and then allow them to actually know that part as well. It is actually something that that's my experience, they do thank you for, because it's like, for them, it's like, okay, you allowed me now to be really close to you, and my idea of you is actually even higher now, but also I realized that I have biased. So that was the kind of conversation that I had, and it was beautiful. So it is fearful, there is fear, it's not easy, and it's not something that you just do lightly, and it took a while, it took a bit of courage for me to do, but it was beautiful. So we can slowly break a little bit these barriers, I think.
And Q, as a Muslim male, can you tell us a bit about how you fit into that community and how that community is changing?
So I relate a lot to my patients. So sometimes I've encountered this where some patients will turn to me and say, "I will pray for you," and then they turn back at me and they say, "Are you Christian?" And they're trying, I sometimes take a moment, try to think of what's going in their brain. And I think for a lot of patients, they're afraid and they want to find a commonality to connect with us. So my answer is like, I love all prayers from all religions, or somewhere where you can be loving and accepting. And fundamentally, that person's not trying to have a theological discussion with you. That person is scared about their little kid or their wife or their husband, and they want to make sure it's okay. And they're trying everything they can to see in you a partner in this. And so all you have to do is kind of lean into the closeness, lean into kind of accept whatever they want to be close to you, form a boundary if you need to. But I think people fundamentally want to connect to you in one way or the other. So give them an alternative, embrace that in a way. You can't get to everyone, but some people you will. So that's my quick advice on this.
Great. Well, On that note, I would like to thank all our wonderful speakers today and my co-host, Julie Samora. I would also like to thank Talissa. I'd also like to thank Talissa Trevelyan, who's been supporting our event today, and perhaps end with Claudia's comment about diversity as a strength, because we know that we need to represent our communities. If we are not a diverse specialty, we do not represent everyone. We know that as more diverse orthopedic community, we can attract the top talent, we'll be more innovative, and we'll make better decisions. And so I'd like to thank everyone who's attended today and for their ongoing questions, and we'll keep this discussion open for the future. Thank you for all our participants, and good morning, good afternoon, good evening, and good night.